This presentation is about why it is important to understand the health labor market. We will look at what a health labor market is and how health labor market analysis provides evidence and guidance information to help address health workforce challenges a country might face. Health labor market analysis might sound very complex. Actually, it is very straightforward and practical and can help to solve real-world problems and is part of health workforce policy development. Solving health workforce issues will increase the population's access to quality health services and help countries achieve universal health coverage and SDG 3. Health labor market analysis helps identify and understand the root causes of challenges faced such as health workforce shortages or surpluses, migration, maldistribution, under or unemployment, the quality of education, gender inequity, and the mismatch between education capacities and employment. The health labor market or job market for the health sector is shaped by decisions made over time by many different actors, from ministries and regulatory bodies to employers and individuals making life choices. Let's look at WHO Health Labor Market Analysis Framework or HLMA through some of the decisions of key stakeholders that shape it. The decisions of high school students about their future careers is an important factor. Shall I study medicine, nursing, law, economics, or become a social media influencer? The Ministry of Education is an important stakeholder in defining the number and type of students in health-related fields. For instance, the Ministry of Education can decide to increase the number of nursing or midwifery students. Private education institutions also have an impact. For example, if 2 new private medical schools are authorized to open, more students will graduate. Once graduated, students join the pool of qualified health workers. Here, some might decide to emigrate and work abroad, or some might immigrate from elsewhere, attracted by better working conditions, including remuneration. Among the pool of qualified health workers, one section will find a job. Others, although actively looking, might not. Finally, some might decide to leave the workforce temporarily or permanently. The large majority of health workers are expected to work in the health sector, but some might decide to work elsewhere due to lack of health sector employment or poor working conditions. Decisions by the Ministry of Health play a key role in shaping the healthcare sector. For instance, it might launch a policy to attract those who have left the healthcare sector. Health workers may decide to work in the public or the private sector, or to work in a town or rural area. The Ministry of Finance is also a key stakeholder influencing the health labor market. For instance, the level of financial resources it allocates to the Ministry of Health might not be enough to employ most new graduates, which might lead to more migration out of the country or to the unemployment of health workers. Population demography, professional associations, the Ministry of Labour, the Ministry of Planning, and the Civil Service also have influence on the labour market. Analysing the HLMA is a good way to gain a better understanding of the health workforce and facilitate the development of policies to move towards a health workforce equipped to deliver quality service for universal health coverage. To support better understandings of the health labour market, WHO has produced the Health Labour Market Analysis Guidebook with clear steps and modules. Usually, the analysis is led by the Ministry of Health, and other important stakeholders participate, such as academia, development partners, and civil society. WHO can provide support at any stage if requested. The Health Labour Market Analysis Guidebook has several components including understanding and analyzing the core elements of a health labour market, practical steps to undertake a health labour market analysis, and translating findings into policy. In most countries, the health and care sector is highly feminized with women occupying a very high proportion of health and care worker jobs. Sectors that are feminized tend to be undervalued compared to other sectors, and women's work within these sectors even more so. In the health sector, on average, women are paid 24% less than men. In addition, the health and care sector can be very demanding, with difficult working conditions and inflexible hours. This can present difficult choices for women, balancing domestic and professional care duties. As such, gender is an important consideration in analyzing the health labor market, and gender-responsive policies are needed when responding to health workforce challenges. When policymakers take decisions about remunerations or working hours or safe working conditions that are free from harassment, they make decisions that affect the economic empowerment of many women. This is a fundamental component of how the health and care sector can improve gender equality. All countries, everywhere in the world, can apply a health labor market analysis and benefit from doing so. Many countries have completed the analysis and implemented policy change as a result. HLMA has demonstrated impact at country levels, such as by informing health workforce investment, strategies and planning, guiding policies on maldistribution, addressing health worker shortages, investing in education to increase the supply of health workers, and developing specific training programs and strengthening career development pathways. Doing a health labor market analysis is not a goal on its own, but is a holistic approach contributing to more effective health workforce plans and policies. It takes an intersectoral approach and should involve a range of stakeholders so that solutions are inclusive and targeted to the real world. Please visit the website and find out more about health labor market analysis and how it can help strengthen the health workforce, or email us at workforce2030@who.int.